Hi, my name is Genevieve Fairbrother, and I am Chief Medical Officer for Atlanta Women's Health Group, and I'm here to provide you with a little bit of information of what's going on in Georgia. The mathematical predictions remain unchanged. We're still on target to reach the peak or the inflection point around the end of April. We're starting onto the steep end of the curve where we go through the peak and we come down on the other side. This is where the majority of cases are going to be, and this is between now and probably the middle of May. That does not mean the pandemic is over. It's just that we will be through the peak volume of people infected with the disease. So what do we know about the viral course? It appears that the incubation period for COVID-19 is approximately 5 days. The majority of people start to notice symptoms between day 4 and day 7 after being exposed to someone with COVID-19. 83 to 98% of patients will present with a fever. Up to 82% of patients will present with cough, and 11 to 44% of patients will present with body aches or extreme fatigue. It is believed that 30 to 50% of patients who have COVID-19 present with no symptoms. This makes it very difficult to have a good public health policy and for physicians alike. How are we managing our office practice? We are still limiting the number of people who come to our office. And by that, we mean only patients. No support members are allowed, and there are no exceptions. We are screening every patient for fever and cough, as those are the leading two indicators. If you have a fever or a cough or think that you might be infected with COVID-19, please call us the day before your appointment to reschedule or to schedule a telehealth or telemedicine appointment. Healthcare today is a rapidly changing landscape. And to this end, we have introduced telehealth and telemedicine for our patients. We think this will be a valuable addition to access us and the healthcare system in general to minimize your risk of contracting COVID-19, but still get the healthcare you need. So please call us if you want to schedule an appointment, and you can do it over the telephone or through a video chat. Of course, if you are a patient who has a problem or an obstetric patient, you may still need to be seen in the office. We are, however, converting many of our patients over to telehealth and telemedicine visits, including some of our obstetric visits. There will be some information on our website about telehealth and telemedicine that you can access. We are suggesting that our patients who are over 37 weeks exercise strict social isolation. The reason we want this to happen is because we want to maximize the chance that you will not have COVID-19 at the time of your delivery. We think that this is a particularly vulnerable time in your life, and we want to try and avoid that as much as possible. We are converting some of our obstetric visits to telehealth and definitely our postpartum visits. We are encouraging our obstetric patients to purchase a thermometer and a blood pressure cuff. We think that all of our patients, OB and GYN patients, should have this equipment at home in case they need to call us and so that they can provide us with more information. Procedures in place at the hospital, some of them are the same and some of them have changed. You will still be met at the outside of the hospital by a nurse and a security guard who will run a short questionnaire on you and take your temperature. You will still only be allowed one visitor for now. There are no visitors allowed, even parents, in the special care nursery. We continue to work collaboratively with the hospital to ensure that we can allow our patients who have delivered vaginally to go home within 1 day and our C-section patients to go home within 2 days. Minimizing your contact with the hospital would decrease your chances of getting COVID-19. We continue to reschedule our elective surgeries. As we pass through the peak of this pandemic, beds are going to be in very short supply. We cannot afford to use a bed that may be needed by a COVID-19 patient when we can delay a surgery by a couple of months. Certainly, emergency surgeries, and those are things like miscarriages, extreme vaginal bleeding that needs surgery, an ectopic pregnancy, Infections that require surgery or C-sections will be performed without delay. Please know that we've been able to cull some lessons from the Chinese experience and the European experience. And here in America, we're adding to that knowledge so that we can take the best care of our patients possible. Thank you for your cooperation and understanding during these trying times.